and welcome to Count on Our Simplified Advice, a 360 podcast that looks at all things employee benefits in partnership with Alex Forbes. My name is Katleho Mosehle, and of course, I am your host, and I'm joined by the beautiful Katleho Mosehle, who is going to help us maneuver the conversation around healthcare as an employee benefit. Now, Katleho is a consulting manager within Alex Forbes Healthcare, and her team offer strategic consulting services to their employer groups. Now, I want to find out how many of us just out of the blue go to the doctor and just do general checkups. How many of us? Let's have an honest conversation. How many of us take up medical aid? Or actually, sometimes you fight with HR when they say, part of your package includes medical aid, but you also have to partly pay for that medical aid. A lot of us take strain because we actually don't understand the value that comes with being able to use healthcare as a benefit within the employer space. Katleho, welcome to our podcast.
Thank you for having us.
I think for me, I want to find out from you. I've had conversations with you, and you tell me about how you love fitness, how you love, like extreme sports, you like quad biking, you go for races. Where did that come from? I mean, yes, you work in the healthcare space, you've been in it for 15 years, but where does the pull towards a healthy lifestyle come from?
I just like being outdoors and having fun with my friends. Yeah. So I can't say where it comes from necessarily, but I just like being outdoors and doing fun activities outside and just getting some fresh air and enjoying nature.
Yeah. So What is some of the most extreme stuff that you've actually done?
Extreme stuff. I've abseiled in the Drakensberg. I think that's one of the most extreme things that I've done. But other than that, just normal things, trail runs, races, mountain climbing, nothing too extreme, just having fun and enjoying the nature that we've been given.
So as you make this call to go abseiling, who do you tell? Because I just would like to let you know that I'm assuming you come from a similar family as I am. The conversations with mom are a bit different. So when you say to mom, hey, I'm going abseiling, how's that conversation going?
Definitely didn't tell my family beforehand. Because you know how families are. They're going to try and encourage you, or discourage you rather, from doing it. And, we have a short life. You just need to enjoy it and do what makes you happy, and just have fun out there and don't regret anything.
Katleho, often a lot of people and as I was explaining this, because it happened to me in my first corporate job, they offered me a salary package that had medical aid as part of it. And, I wanted to say to the HR lady, excuse me, I don't need your medical aid. I will go and find my own medical aid. And I think ultimately that's one of the biggest questions that I want to speak on, the cost saving of going into, medical aid or any type of healthcare benefit within the group, within the employer versus you going at it on your own. But I think to just kick off our conversation, perhaps we can talk about the value of having healthcare benefits. What does it look like for me as an employee? And perhaps maybe if I am a small company and I'm a small business owner, and maybe we can touch on just at the end if you are an employer.
Okay, I think one of the most valuable things, of course, for employees and employers, as an employer, you want to make sure that your employees are healthy, happy, and productive in order to sustain your business. And as an employee, you want to feel appreciated. So you want to know that whatever package you've got allows you access and freedom to go to a private healthcare practitioner, which would mean that you would have less wait times than perhaps using a state facility. It also has more convenience. You're able to book a specific time. You don't have to take the whole day or half a day out of work. So in terms of convenience and accessibility, it is better for the employee. And of course, some employers do offer subsidized benefits in terms of their healthcare cover, whether they've got medical aid or primary healthcare insurance. They may subsidize a portion, which means an employer or an employee rather would be able to take up a cover that they would not necessarily be able to afford from their own pocket if they were not subsidized. One of the other benefits, of course, if you've got obviously a healthcare advisor that would assist you, most employer groups would have their own accredited healthcare consultants that would assist them with these benefits. is you can negotiate with the medical schemes because you're coming as a large group. You can negotiate the underwriting terms, whereas an individual on the street would perhaps face more adverse underwriting conditions when they want to take up medical aid. And as you said at the beginning, generally when we're younger and healthier, we don't want to spend money on medical aid. But the reality is a healthcare event can happen at any time and can happen at any age. And often we don't have the financial means to cover that, the full cost of whatever treatment from our pockets.
Sure, you just hit me with a bomb of information and I'm like, hold up. Let's quickly fragment a couple of things. Let's talk first underwriting. You mentioned it quite very expressively to say that, with group cover, and if you're coming in as a group, the underwriting it's a little bit easier on you as an individual. Whereas if you go about it by yourself, you may just face a whole lot of underwriting. So tell me, what is underwriting in the simplest English you've got?
Simplest English.
Yes.
So basically, I'm sure almost everybody has been exposed to some kind of insurance benefit, whether it's healthcare or life or car or home or whatever.
Yes.
And often the risk is on you as an individual, right?
Yes.
So if you're coming as a group, you're able to negotiate. You've got the power of numbers. That's the easiest way to explain the power of numbers. So within the healthcare space, we have what we call underwriting for pre-existing conditions. We've got for individuals who may not have ever had medical aid or had a break in cover, they would experience a 3-month general waiting period. And we also have what we call a late joiner penalty that would apply for people over the age of 35 who may not have had medical aid or had medical aid but had a break after turning 35. So coming into an employer group base and you join as a new employee, you would find that the healthcare consulting firm that is appointed by that employer, as well as the employer, have agreed with the schemes that, service that particular client to say, if you join within 30 or 90 days of your employment, you will not face any underwriting. So that's it's a nice to have because you know that you've got cover from day one. Whereas an individual just joining by themselves to a medical scheme would probably still have the full underwriting applied to them.
Sure, that is actually fantastic. I didn't know that and I think that has been very off-putting for me. Every time I try to join a medical aid, I was told about a 6 months waiting period because I've got a pre-existing condition, So I always stressed about it. And then they tell you that, and then you're just like, let's leave it, because you're so discouraged. So it's nice to hear that, employer groups have an advantage to be able to negotiate the terms and conditions in the interest of their employee, so that when the employee walks in, I can imagine you're a new employee, let's say maybe you're even pregnant, and you're stepping into this new job, and all of a sudden you literally get cover from day one. That is absolutely fantastic. There's also something you spoke about, which I think you said it, and I was like, oh my goodness. You talked about the importance of being able to get private healthcare, which we know in South Africa is a huge privilege, but waiting times. I mean, if anybody has ever gone to a public hospital, you know how difficult it is. And because our staff there is overworked, but also there's just no actual administration that's happening well. So organization is not working well. You're waiting, and sometimes you can't afford to wait. And that's also one of the most important things that a lot of young people sometimes overlook based on the fact that they think they're healthy. There was a running joke on social media. Somebody asked the question that if you and your partner are in an accident, you have medical aid and they don't, do you leave? I don't know, Katleho, what do you do? Do you leave your partner?
Yeah, it's a dilemma.
Because why do they not have medical aid? What's going on?
And within the medical aid space or even health insurance, you could choose a package that is affordable for you. You don't have to be on the most expensive benefit package, and often people make that mistake. So we're more risk averse. So when we can afford healthcare, we want to be on the highest package, and that's not necessarily the case. You can be on one. There's quite a number of what we call EDOs, efficiency discounted options within medical aid. That means you're able to get a still good cover with unlimited private hospitalization, just perhaps requiring you to make use of a network. So you know that for planned procedures, you need to make use of these specific hospitals. The scheme could also request that perhaps for day-to-day visits, you visit these specific list of doctors, but it is still very affordable. So it just shows you that at any type of, or rather at many bases of incomes, you can afford some kind of healthcare. And as we said, there are some benefits to coming through or joining a scheme or health insurance product through your employer group, because they would have had the negotiating power to actually make that favorable for you.
You spoke about something else. You spoke about, sometimes they offer you a subsidized medical aid or health insurance scheme that you would have otherwise not been able to tap into if you were doing it on your own. Just give me a bit of an example there so that I can get a bit of a picture of what, because when we talk about subsidizing, it may ring differently for different people.
Yes.
What, if you can just give me a hypothetical, let's rather be very clear that it's a hypothetical situation. Yes.
So you would find, there's quite a number of employers that would give you a rand value subsidy or percentage subsidy based on the plan or cover that you're on.
Okay.
So, some employer groups that we represent would give you a 40% subsidy perhaps for the main member and the adult or spouse dependent.
Yes.
Some employer groups have subsidies for people earning less than 10,000 rands as an example. So employer groups would try and cater for their employees and their base that they've got. And I think everybody would appreciate that depending on the industry that you're in, the size of your employer, different things work for different employer groups and obviously for different employees. And obviously the demographics of the employees would then determine what is favorable or what is possible for that employer group.
Yes. And as an employee coming into that space, here is a benefit for you. It's a healthcare benefit. How much wiggle room do you have to be able to influence whether or not, let's say for instance, I say, but I've come in with my own medical aid. Is that something that is acceptable?
To be quite honest, Nicolette, we do have employer groups that, I guess within the whole country, there are employer groups that give freedom of choice in terms of you can join any medical scheme.
Yes.
However, there are downsides to that because it is a bit of an administrative
nightmare. Let's call it a nightmare. It's administrative work.
Yes. Because it would mean that the payroll system would need to cater for cater for the deductions. Within payroll, somebody would need to do the billing, the reconciliation part on a monthly basis. Yes. So it does affect the dynamics of the payroll system. Yes. Unless of course they say pay from your own pocket, but then the risk pay, as in you have a debit order with that particular medical scheme or insurance. The downside of that, of course, is that I can just wake up and cancel when I've got financial problems and my employer wouldn't know whether I've got cover or I don't have cover. So that is just generally within employer groups, they would say you've got an option of these X number of schemes, whether it's 2 or 3 or 4. Of course, as I said, it does become quite complex to manage the more schemes that you've got. But generally 2 or 3 schemes is what a lot of employer groups go for.
And I'm sure it's obviously at the discretion of the employer group. It's not something that you guys would probably have control over. However, your team of experts would then go in and consult and offer that type of strategic guidance in that space.
That is correct, Nicolette. We would go in and look at what is the employee base? What is the average age? Are we suffering with specific types of chronic illnesses? And also where is that employee based? So you want to make sure that whatever healthcare cover you bring in complements the staff that is there and would benefit the staff. So you don't want, for example, to get people on a scheme that only has networks in a specific area.
Yes, but they don't exist.
They are somewhere else. So we look at that, and that is part of the consulting services that we offer is what would work best for this employee base, where they're stationed, the industry, etc. Yes, so we do look at quite a number of factors before determining.
I like that because I don't think many of us, when we're in the employee seat, think about the fact that our employer has actually extensively consulted on the benefit that they're offering us. So obviously what you're saying to me is mine employee healthcare benefit will look very different from another industry that does not have any similarities with the mine. I like that because I don't think, and my mind is blown because I'm sitting and I'm like, I didn't know that. Sometimes you think just offer your employees the best, the best and cheapest medical aid that's available. But what if it doesn't speak to their needs? And I think that's quite something. But let's talk about what are some of the expenses that you will typically find covered by your healthcare plans.
Okay, so if you'll allow me, I just want to perhaps just touch on when we talk healthcare, there is medical aid and health insurance, right?
Okay.
So health insurance really came in as a way to assist people who'd never been able to afford medical aid or could not still afford medical aid. So it is a lower cost. It comes in at a lower cost than medical aid, and generally does not have the unlimited private hospitalization benefit that medical aid has.
Okay.
Some of the private insurance service providers would offer a rand value benefit. So where they anything between 1 million and 3 million rands, for example, per beneficiary or per family. Some don't offer that. Some would say, you know what, we'll only offer cover for emergencies, or we'll just stabilize you and then transfer you to a state facility. However, it is better than not having any cover at all. One of the main benefits of having a private health insurance product is that you actually would normally have unlimited day-to-day benefits with a GP or a nursing practitioner. So again, what we talked about earlier, reducing the wait times, accessibility to a private physician. So you would still have that. And quite a number of these products would also have benefits for medication, whether it's over-the-counter prescribed medication. And sometimes as well, having a nice benefit.
But also not having to call the family meeting every time someone is sick. Like, how are we going to take this person to hospital? Yeah.
So that is very nice. And you would find even within our clients, we have quite a number of clients where we've got a number of lower income earners that are on primary healthcare insurance products, because it still is quite a nice benefit to have. And it's basically plugs the gap for those who find medical aid to still be a bit too expensive for them. They still have access to private healthcare cover. And then, of course, we have the medical aid schemes, which I'm sure many people know about or on one. So within the medical aid scheme, I think generally we need to touch on a few things. One, private hospitalization for everybody. I think that's one of the biggest things, because
that's a key one.
The average person would be able to afford a GP consult every now and again, but the most expensive healthcare costs actually come with being hospitalized.
Absolutely.
So generally hospitalization is unlimited. As I said earlier, there could be options that offer you benefits within a network, and it's a way also to keep your healthcare costs down on a monthly basis. So that's something to look at. Within the medical scheme base, every single plan that you're on, so it doesn't matter how much you're paying, every single plan that you're on has to cover what we call prescribed minimum benefits. People have heard of PMBs, people have heard of chronic medication. PMBs is basically just a list of about 271 conditions and treatments that a medical scheme needs to cover, including 26 chronic conditions. The 26 chronic conditions are some of the most common. Your things like asthma, diabetes, high blood pressure, tsukiri, as we say, as well as hypertension, which is obviously high blood pressure. So quite a number of the most common are part of the 26 chronic conditions. That means the treatment, the medication, and the overall care for that particular patient or member, as well as for that particular condition.
Doesn't matter what medical aid you're on.
Doesn't matter what medical aid you're on.
Okay.
Of course, the scheme can again say you need to make use of this particular designated provider. There could be a network, or could be specific doctors.
Okay.
Or some schemes actually have what we call coordinated care. So for specific, sometimes I think we know that most people would suffer from diabetes and would also have high blood pressure or high cholesterol. So the scheme would say, you know what, you need to make use of this DSP that would look after all these conditions collectively, and not just have different doctors or different specialists looking after each little thing. So that's just some of the benefits that you would get over and above. I think everybody would obviously know that you would also get your GP consultation, specialist, maternity if there was. But just be aware, of course, based on the option that you're on, you could get more or less of some benefits, and some don't exist at all. Because within the medical schemes as well, you would have what we call just hospital plans. You could cover for hospitalization only, no day-to-day benefit. And of course, there's other things that you can go into, but that's too technical. Just to give an overview, so people know the kind of cover that there would be that would be available to them.
And then there's a thing called gap cover. What is that?
Okay.
Because I hear it even throws around gap cover. What is it? Yeah.
Gap cover plugs the gap.
Okay.
But that's the easiest way to remember. It's just that, but basically gap cover is short-term insurance. So it is to assist you if ever there was a shortfall between what the scheme has paid for an in-hospital event versus what the healthcare practitioner has charged. Most of the time, gap cover really covers you for in-hospital treatment. I think people need to know that. So if your savings or your day-to-day benefits run out, gap cover is not going to be able to help you there.
You can claim from gap cover, basically.
It will help you in hospital. And I think also perhaps this is an opportune time to just touch on within medical schemes, you would have co-payments, often for scans, MRIs, scopes, some in-hospital treatments.
Yes.
So GAP would pay, some of the GAP providers would pay for some of those co-payments.
Yes.
So it's also a nice way to beef up your
Yes.
cover.
Yes.
So if you know that you can't afford the most expensive plan, and sometimes you shouldn't be on the most expensive plan, you can take a mid-range, medium cover option and then take GAP, so that if you are in hospital or one of your family members does require a shortfall benefit, you've got the GAP cover in place to assist you.
I want to speak about exactly that, the family benefit, the extended family benefit. That's the other benefit that comes with probably being part of a group benefit, right?
Yes.
Talk to us, what does it look like? Because we all say it extends to your family members, but what exactly is the extension, and what is how long is this rope?
Yes. So I think, of course, many employers understand that most of us are very close to our families, and we obviously want our families to be well.
Yes.
Because I think, if you've got a close family member that is unwell, it also affects you. It affects how productive you are. It affects how focused you are in the workplace.
Absolutely.
So most of the time, employers would look at whether it's through their healthcare benefits or whether it's through their employee assistance program, their EAP program, would look at ensuring that there is something available for your extended family.
Yes.
So as an example, we just touched on GAP now.
Yes.
Generally, when we negotiate for GAP cover for our employer groups, it would mean that the cost that you would pay would be much lower than if you went to a GAP service provider by yourself.
Yes.
And that cost would also include your family. Generally, GAP covers, it's also very nice if you're younger than 65, you normally would be able to get a very nice rate. And as I said, it would supplement your healthcare cover, meaning you don't have to be on the most expensive cover. You and your family could still be on a mid-range or a medium cover option.
And then
have
take up GAP. Yes.
And your family is still covered. So all the individuals that are on your medical aid would still be covered on that GAP cover, instead of paying, for each and
How
every...
far can I take it?
You can't add your grandma. I'm sorry. You can't add your extended, your uncle that went missing and has reappeared over Christmas. So generally we look at, when we talk about your family, we talk about your close family.
Okay.
It would be yourself, your spouse, or partner.
Yeah.
Your biological or adopted children, things like that. In certain instances, I must be honest, it's quite rare. All the schemes and service providers work a little bit differently. They would allow you, for example,
your mom,
your parents, your in-laws.
Yes.
If you've got a younger sibling that has nobody looking after them, or your niece or nephew. However, that is rare circumstances. Generally, when we talk about your close-knit family, it's your immediate family. It's your spouse, partner, your children.
Generally your financial dependents.
Yes, exactly.
The closest people. All right. You again also touched on EAP, your employee assistance program. What is it? What does it look like? What does it do? And which part of the employee benefit does it hope to serve?
So it complements the healthcare benefits very well. So an employee assistance program basically generally should be at no cost to the employee. It is a benefit that a lot of employer groups offer and should offer. I think the past, I almost say 2 years, but it's almost going on 2.5 years now, have shown us that a lot of people are suffering with mental illness.
Yes.
A lot of people are suffering with relationship stress. So an employee assistance program would assist the employee confidentially. I think that's also the main thing. There would be no reporting back to say, Katleho did this, Nicolette did this, back to your manager or HR rep. All the services are confidential, so you'll be able to access counselors or psychologists and, get assistance on your stress management, on your relationship management. And a lot of EAPs actually offer legal assistance. They offer financial well-being. And I think also looking at the stress financially and where the economy is going now, a lot of us do need to be aware of where we are financially. We do need assistance with our financial management and personal finance in general. So it is nice to know that you've got a program at no cost to you. And a lot of these EAPs actually, in fact, within Alexander Forbes Health, we've partnered with Life EHS, I don't know if I'm allowed to say that, to offer an employee assistance program. So definitely employer groups can contact us, and obviously we would quote for them and obviously present to them the benefits that we offer. And I mean, a lot of these EAP services are offered on, we do video calls, there's apps,
make them accessible.
Email, there's telephone. It is very, very accessible. And as I said, it is at no cost to the employee. So it's to just make sure that the employee has somebody professional to talk to, somebody with experience, somebody that can assist them, walk with them, whatever the path that they're walking through.
I want to find out, I used to consult for an advertising, I was in an advertising agency consulting on a client. It was actually a government client. And they had a benefit where they could pay for you to get bailed out.
Wow.
Would that fall under EAP? Bail you out.
I don't think we bail people out, but we can walk you through your legal issues.
All right, makes sense. But I guess you're very correct. I mean, I'm just thinking now, mental health, people are now working from home. So it's also just really creating an environment where people can be productive. So with people working home now, has it changed the dynamics of how you guys offer the EAP program?
Yes, I think more people are obviously now using the mobile apps that are available, the video services as well. And definitely over the past couple of years, we have seen a rise in people seeking assistance with managing their mental health, people seeking assistance with managing their personal finances, because often, or not often, many family dynamics have changed since the first hard lockdown that we had. So definitely we've seen a change. We also do within our EAP program offer an ergonomic solution that's to assist people to sit properly, because part of stress is now we sit badly and we slouch and we do all these
correctly.
things. Exactly. So we do offer good ergonomics. We do in one-on-one consulting. We actually also offer it as a standalone benefit to employer groups that want to obviously assist their employees with their posture and sitting well, and just making sure also that their employees are comfortable, because we're all working at home. We all have different ways to sit. We may be able to afford these funky chairs or may not. But the reality is, before we all worked from home, we had nice, comfortable chairs we took for granted in the office.
Yes, that's very
and
true.
Now at home, well, we're sitting wherever we're sitting.
On the couch. Yeah. On the couch. On the laptop, right?
So the economic solution that we offer is to assist individuals, obviously, and employer groups as well. With that.
Yeah. Tell me, just a quick one before I let you go, Katleho. What have you guys seen as, the benefit of having healthcare as an employee benefit, from an employee perspective, and then because you spoke about productivity, we didn't really touch on absenteeism, but what would be the biggest benefit that you guys have seen when an employer group does offer these benefits and where employees know about them? What have you seen? What type of changes have you seen?
So I'm glad you raised that. So definitely the absenteeism is more controllable. So within employer groups, we have absenteeism and presenteeism. Right? So absenteeism is when people are obviously off work, and then presenteeism are people that are unwell but may not afford to be off.
They don't have leave days.
Either they don't have leave days, or they don't have healthcare benefits, right? So they come to work while sick, and obviously that's not ideal. So definitely where there is a healthcare package available, whether it's medical aid or private health insurance, as we said, it reduces that stress on the employee. And also we find that absenteeism is more controlled and more manageable within that particular space, because people would take sick leave when they need to take sick leave, or whatever leave that they need to take. And also presenteeism would be drastically reduced, because people that can afford or have got healthcare can actually afford to go see a physician or go see, any other healthcare practitioner to get a medical service, to get their checkup or whatever the case may be. So it means that people are free to go and they're not too worried about, and as we said, if you've got private healthcare cover, accessibility to private healthcare practitioners it's simple, you can just make an appointment, go there. You don't have to wait in a queue for X number of hours and wake up early and those things. So obviously it does affect that dynamic. So so I think in an instance where employees do have healthcare cover, in terms of accessing healthcare practitioners, it is very, very simple, very beneficial to them. And the value to the employer is that they know that their employees, obviously, when they are off, it is due to a genuine reason. And we obviously have then reduced presenteeism cases as well. So overall, and of course, the benefits, as we said, to employees is that they would also be living a much healthier, happier life. There is nothing as stressful as not knowing how to pay for, a C-section in a private hospital. It's one of the most expensive, health events, as an example. So if you've got healthcare cover, you know that this would be covered. It gives you peace of mind as well. And obviously will alleviate any other mental strains that you may have.
Sure. Katleho Mosehle, Consulting Manager at Alex Forbes Health. Thank you so much. You've been absolutely fantastic. Very valuable conversation we've had today. And I think one of the things that you stressed out, and maybe I want to give you another chance to just appeal to young people when it comes to healthcare. What would you really want them to understand and know and take to heart?
Yeah, Nicolette, I think, again, just to reiterate, you do not have to be on the most expensive plan offered by your medical aid or health insurance provider. You can be on a medium range. You can even be on a lower range. You can be on a hospital plan only. You can be on a network plan. There isn't a right or wrong, but you don't have to be overinsured while you're still young. But do have cover, especially because you may be able to afford, a dental visit. You may be able to afford a GP visit, but many of us don't have the financial means to be able to afford a private hospital visit for an unforeseen emergency, So that is what you want to have. You want to make sure that you've got a package that covers you for those unforeseen healthcare events.
We absolutely appreciate your time.
Thank you for having us.
Thank you very much for watching. Count on our simplified advice. It is in partnership with Alex Forbes. As you see, we try to simplify employee benefits, and that's exactly what Katleho has just done. I will see you guys on the next one. See you there.